He says many people in South Carolina have ignored the advice of public health experts to wear masks and avoid large gatherings. We have to understand that this is going to happen, says Dr. Sarah Fortune, professor of immunology and infectious diseases at the T School of Public Health. Chan School of Public Health. Other states where the number of cases has increased by 10% or more in the last 2 weeks include Alabama, Alaska, Arkansas, California, Florida, Georgia, Idaho, Kentucky, Louisiana, Nevada, New Mexico, North Carolina, North Dakota, Oklahoma, Oregon, Tennessee, Utah and Vermont. He noted that South Carolina has had one of the highest daily numbers of COVID-19 cases in the past 2 weeks, and that the percentage of positive COVID-19 tests has also increased, indicating that the virus is spreading again in the community. Banner Health, the state's largest hospital system, reported that its intensive care beds are filling up rapidly, and the number of IDOC-19 patients requiring ventilators has increased by nearly 500% since mid-May. He said the measure of success will not be whether the United States sees an increase in transmission, but whether we are able to prevent an exponential increase in COVID-19 infections so that individual cities and states do not lose control. Kate Brown called for a pause in plans to ease restrictions late Thursday after public health officials said Oregon had recorded the highest number of new cases since the start of the pandemic. They did what they had to do, said Carlos Del Rio, an infectious disease physician at Emory University School of Medicine in the Grady Health System. In Atlanta, Sarah Fortune, MD, professor of immunology and infectious diseases, Harvard T.H. Chan School of Public Health, Cambridge, MA. Today, I am more concerned than ever about the IDOC-19 in South Carolina. Dr. Linda Bell, the state's chief epidemiologist, said at a June 10th briefing. This is clear from data collected by COVIDexitstrategy.org, a website run by a team of 10 public health experts and based on data collected by the VIDA Surveillance Project and the CDC. Carlos Del Rio, MD, professor and chair, Department of Global Health, Rollins School of Public Health, Emory University School of Medicine, Atlanta. Bell, the South Carolina state epidemiologist, says he has seen some of this confusion occur in his state. Public health officials from other states have joined in these fears in recent days. Will it work? That depends, says Dr. Tom Inglesby, director of the Johns Hopkins Center for Health Safety. But other governors, including those of Texas, Arizona and Arkansas, have said they are not considering future suspensions, even if cases increase in their states.